everyone, my name is Dr. Tanno Kaur. I'm with Greater Washington Advanced Podiatry, and today we're going to be talking about one of the most commonly seen problems in my office, and that problem is plantar fasciitis. So we're going to be discussing what plantar fasciitis is, some tips for you guys, and some home solutions. So stay tuned, and thank you for watching. So what is plantar fasciitis? Essentially, patients describe plantar fasciitis when they feel a sudden onset of heel pain. It's usually worse first thing in the morning when they first put their foot down. Sometimes it can be correlated with a trauma, but usually it does not have to be. And if we want to get into the anatomy of it, so here's my handy dandy diagram for you guys. So essentially we have the Achilles tendon that runs in the back of our calf. And when it goes into the foot, it forms the plantar fascia right in here. So when we have tightness or equinus of the Achilles tendon, we can sometimes have extra strain on the plantar fascia. And where the fascia inserts into the calcaneus right here, we can get an increase in inflammation and an increase in pain. So what are some ways we can address our pain? The number one thing I always tell my patients is proper offloading or shoe gear. So whenever you're looking for a shoe, you always want to look for a shoe that is sturdy. It should not, when you try to bend it, have any give in the middle. The sturdier the shoe, the less your foot has to work in it, and the more supportive it is. So shoes like New Balances, shoes like Brooks, are extremely great. They're extremely supportive. Then the next thing you want to do is you want to stretch and address the equinus, which is causing pain in the first place. So the key stretch I tell my patients first thing in the morning, even if it's just 2 minutes each, is the toes to the nose stretch. So essentially you want to take a towel or a band, place it right along the midfoot and bring the toes towards the nose. You could do, 10 reps of this exercise, maybe just 4 to 5 seconds each. And if you do this religiously, trust me, you will notice a difference. Other two stretches that I highly recommend that also are runner stretches is number one, this stretch right here. So this is the Achilles stretch. So essentially you put your hands up against the wall and you extend your knee out. You want to keep it straight. This targets both the gastroc and the soleus muscles, which makes up the Achilles tendon. You want to again hold this stretch for 4 to 5 seconds, 10 reps each. And then the next stretch is the same stretch as prior, except you just want to do it with your knee bent. And this specifically will target the soleus muscle. So again, 4 to 5 seconds, 10 reps each. So once you've addressed, the pain with offloading, stretching, sometimes there can be inflammation that needs to be, targeted with an anti-inflammatory or a corticosteroid injection. That is something that, you would need to see your local podiatrist for and, get their recommendation on. Sometimes this pain can be, more chronic. There can be scar tissue. And for that, we also have, further, more advanced treatment modalities. But, try these things if you're suffering with plantar fasciitis and go see a local podiatrist to help in the treatment. Thank you guys so much for watching. Have a great evening.